oh, I just can't do jumping jacks anymore. Since I've had kids, that's just, it is what it is. It is not what it is.
Thank you.
You should know that you should be totally continent.
Forever.
And you should not wake up 5 times a night to pee. I think if you're over the age of 35, you're allowed to get up once a night. But yeah, if you're finding that you're saying to yourself like, oh, this is just because I'm fill in the blank. No, it should all function normally. And when it starts not functioning normally, go seek help to bring it back to a normal state.
You're listening to Turn Your Soul On Radio. I am your host and visionary doctor, Dr. Brandy Victory, and my mission is to assist high-achieving women in closing the gap between feeling unfulfilled to living a life on fire. It is time, ladies, to champion our own lives and turn ourselves on. This is Living Victoriously, ladies. This is how you turn your soul on.
Hey Soul Sisters, I am so excited to be with you here today. I get to introduce you to an incredible woman who's doing fantastic work in the world. You are going to appreciate this conversation. She is Jenn Lane, and she is a holistic physical therapist with a chock full box of toys in her toolbox. So I'm so excited to be able to share her with you, because you are going to want to jump in on some of this yumminess. Jenn, would you say hello?
Hi, everybody.
Hello.
Yeah, so would you like to just talk a little bit about...
Well, thanks so much for having me.
Yeah.
This is like such a fun way to spend my day. My name is Jenn Lane. I've been practicing physical therapy for 17 years. And I think my journey into a more holistic approach has evolved over the last 4 years or so, and has really taken me to a really wonderful new place where I have my own practice that allows me to bring health to people in my own special way.
Awesome.
Yeah.
Yeah, I love it. I love the work that you're doing. I'm kind of selective about the people that I interview, and the reason why is because I do this. This is part of the Ambition and Grace series, which is an interview series that I do, and we do this because I want women to know that they can too. Like, they do not have to be stuck in their story. They do not have to let limitation and lack get in their way. Like, there is a way to get through.
Absolutely.
Yeah. And I know I don't know you all that well, but I get that you get that. And I get that you are constantly evolving yourself. And so I know evolution, there's challenges with that. So it's just going to be a fun conversation, I think, to explore how it is we get through those challenges and lift ourselves up.
Right, I agree. It's been a great journey, and it's been going on for years, whether I knew it or not. But it's really wonderful, and the power to change and not feel stuck is something that's really important to me.
Yeah, awesome. Yeah, me too. And we all get in those spots, right, where we're like, oh my God, what's happening? I think the last podcast I did, I was like, I had a freak out in the bathroom, and my girlfriend was like, what's wrong with you? Like, oh my God, I don't know what's wrong with me, right? We all get those moments.
Absolutely.
Yeah, and then if we continue to explore, we can find our way out of them. And so the essence of this offering is to give women a hand, so they can go, okay, let me just explore a little bit deeper. Maybe I come get some pelvic floor work, which we'll be talking about, ladies. Maybe I come get some physical therapy because my body's hurting me and I can't get in my groove because my body's hurting me.
Right.
Yeah. There's a lot of things. So maybe tell us a little bit about, I know you've got so many things that you do. I know you do personalized programs that are very specialized for each individual. And I'm curious about so much of it because I don't know what vestibular rehab is.
Okay.
Let's start there.
Yeah. Well, and I think a lot of it, and for physical therapists in general, where people become physical therapists because they want physical therapy themselves. They're seeking something for themselves, and it comes out of usually an experience that they have with injury or dysfunction. So when I moved to Colorado 20 plus years ago, I was hit by a car on my bike, and suffered a major concussion and was dizzy, just horribly so. Anytime I moved my head, the room would spin. I felt horrible. And I was told by multiple doctors that I was just going to have to deal with it. And in my journey, when I got to physical therapy school, and it was the vestibular section of our coursework. The vestibular system is your inner ear in very simplified terms. And they said, let's talk about dizziness. And would anyone like to come up and be a guinea pig? And my hand shot up. And after talking to the instructor for a little bit, he treated me and corrected it on the spot. No more dizziness moving forward.
No kidding.
It was amazing. So I think my passion when I first started PT school was to work with people with vestibular issues, because it is so debilitating, and a lot of times people just don't know how to handle it. So it can be, in my case, it was crystals in my ear were dislodged and stuck in a semicircular canal, which is another structure of the inner ear. And it was creating a sense of, it was tripping a sensor in my inner ear saying that the room was spinning. And when that happens, your eyes move involuntarily and give you this really horrible sense of the world spinning around you. Right, so different coursework, different mentors, different things that I've done, I've been able to help people with a ton of different dizziness issues, whether it's what I had, which was called benign positional paroxysmal vertigo, BPPV. It's a mouthful, to things like labyrinthitis, which is like a acute inflammation of the inner ear. So lots of different things to treat, and people really suffer from it. And I love helping those people, and I had personal experience with it, which it was really debilitating to me. So that's just a natural place for me to have started with my practice.
Awesome. Thanks for sharing that. And I love it that you said that, because I have a handful of people who have inner ear stuff or dizziness or vertigo, and I can adjust their neck. I can adjust their suboccipitals,
Right. Right.
Yeah, so it'd be really nice to be able to send them along.
Absolutely.
And get some real help for that.
Absolutely. Yeah.
Yeah, and so what's functional dry needling? I've had dry needling. I love dry needling. And it sounds to me also from the previous conversation that we had that you're evolving your dry needling practice.
Right.
But what exactly is functional dry needling?
Functional dry needling, I just took a class this weekend, so it was a good review on this. So there's trigger point dry needling, which is specifically targeting muscles. So bands and muscles that are tight or dysfunctional, and you dry needle the trigger point. So that's one brand of it.
Okay.
Functional dry needling also looks at the radiculopathy of pain, so that being whatever the nerve root from your spine, that pain impulse that it can send to different body parts. So the functional piece is treating the nerve root, like the source, and affecting the part that's hurting that's farther away from the spine.
Oh, wow.
So, for instance, right, like, so if you have hip pain in the side, like we all do, like that IT band syndrome stuff that people talk about, well, the gluteus medius is innervated partly by L5 nerve root. So if I dry needle L5, I can affect the gluteus medius, and thus in turn reduce your pain in your hip, but also improve the function of the muscle.
Oh, wow.
So it's much more than finding trigger points and treating them. It's treating the nervous system also.
Wow. So I've been reading about how the pain pattern gets stuck in a nerve loop. So, maybe the injury happened years ago. Like I have a hamstring injury that I injured from running years ago.
Right.
And it's getting so much better because I've been working on myself. But I can sense that it's still something in there. And I know that it's not hurt. You know what I mean?
Exactly.
But there's still a pain pattern that shows up in it, and I'm wondering if this functional dry needling actually can resolve that pain loop.
Yeah, and I think in the first class I took for it, the instructors were saying, use the functional dry needling to make a muscle relax. Use the functional dry needling to make a muscle contract. And I was like, well, how does the needle know what it's supposed to do, if it's supposed to turn it on or off? And they said, well, think of it as a reset. So whatever nerve circuit you're trying to get into, pain circuit, or a muscular trigger point that you're trying to get into, it's just a reset button. So it is part of the picture, but it's then how you follow up with it. So like for you, with like a chronic hamstring strain, you get in on the hamstrings, you get in on the nerve roots that fed the hamstrings, and then after, then you do some gentle contractions to show the hamstring that it can contract without pain.
Oh, interesting.
Yeah, so you have to reinforce it with a follow-up, usually a home exercise program, whether it's stretching or strengthening or a combo. So it's not a standalone treatment. Yeah.
Yeah. Yeah, it makes sense. Like it's
right.
any,
reinforce it.
Yeah, I mean, we don't, there's never a magic cure, right?
Yeah.
And you can retrain the whole complex, not just the muscle to turn on and off, but the whole nerve root.
Exactly.
And teach your body that it doesn't have to be in pain. I love that.
Yeah. And it definitely, for me, feels like cheating as a physical therapist. I've spent my entire career being very hands-on and manual skills with my clients, and working on the muscles with my hands and working on the joints and helping the nerves. And with the dry needling, that does all the work for me. And then I'm just educating people on how to change their movement patterns.
Wow.
So it helps me save myself, so I'm not working so hard and injuring myself.
Yeah, and I mean, from my own experience, I've had a bit of dry needling, and it's all been so amazing. It was just like a godsend for me to just get to things faster. Yeah, it's so much faster. I mean, I've been doing physical therapy on this and this and this, and then finally she's like, let's do some dry needling, and it's like, boom, and cleared it right up.
Exactly.
Yeah.
Yep.
I don't know, I'm wondering if you have seen that, because my experience may be different than other people's, but traditionally, when I get dry needling, I will have some sort of emotional release. Have you noticed that? That's common?
So, yes. So I've had, part of what I do, and we'll talk about, is pelvic therapy. And I had a woman come in who has a lot of anxiety and emotions surrounding her pelvic floor, and experiences with sexual relations and just the pain she's experiencing. And I dry needled her inner thigh muscles, nowhere near her pelvic floor, just the hip adductors. And she told me she cried and had this huge emotional release later that day. And I felt so bad about it initially. And she says, no, it was amazing.
So good.
She's like, I felt like I needed to get rid of it.
Yeah. You don't even know that you're holding on to stuff, Like,
yeah.
I remember one time I did a dry needling, and I think she was in my cervical spine, and she had put the electrodes on it and was contracting and releasing the muscle, and a vision came right into my head when I was 6 years old, an event that I had with my mother, and I was like, oh, there's that. And of course, I don't want to scare her, so, she's she doesn't know me, right? And so I don't want to scare her and tell her what's going on in my head, but it sure would have been cool to have been able to process that as it was happening, like, oh, okay, I'm getting this, oh, I see, this is happening, this is an experience, this triggering this experience I had with my mom, but of course I waited till I got out of there, and then I went and laid in the grass and broke down and cried for an hour.
Right. Well, and I'm learning a lot of this as I go, and so that's really good insight from you that I should cue people, like, if you have an emotional response with this, feel free to talk to me about it.
Oh, yeah.
Because I know, really classically trained as a physical therapist, it's the physical. And I think my journey into the holistic realm is allowing for the emotional piece and all of that other stuff that's so important for overall health. So learning these little tricks and things that I should be building in to really be true to that holistic title.
Awesome.
Yeah.
I love that.
Yeah.
Yeah, and I'm not so sure how much dry needling works with the fascia. Does it have anything to do with that?
It can. It can. The dry needling I do really works deep into the musculature, but there are some fascial techniques, usually around scar tissue,
Okay, yeah.
that
Right,
you
would make
can
sense.
use it to break it up.
To break up the
Yeah.
adhesions and
Yeah.
yeah. Yeah, I'm not sure. Do you know Dr. Gabriel Cousins? Have you heard of that name?
I'm not familiar, no.
He wrote a book called Spiritual Nutrition.
Okay.
Okay, it's not something you read overnight. It's a Bible. And one of the things that it just stands out for me as we're having this discussion from that book is that he says the fascia is where spirit integrates into the physical. And, when we get like trigger points or we have injury and we have a scar tissue build up in the fascia, it's like, can we release that stuff and let ourselves be more in our body as a spiritual being? And I think that's a lot of, regardless if it's PT or massage or
Right.
roughing or dry needling or whatever you're doing, highly encouraging you ladies, go out and get some release in your body. If you feel like a little trigger point, like that has an emotional component to it.
Absolutely.
Yeah, for sure. It's just amazing because when we start to let that stuff go, and sometimes I think this sounds really scary for a lot of people, like, I don't want to do that,
Right,
I don't want to
right.
break down and cry for an hour after I do dry needling.
Yeah, right.
Yeah, and what's on the other side of that is freedom.
Agreed. Yeah. It is a process for sure.
Yeah, amazing stuff. I just can't speak highly enough to it. All right, so let's kind of go into the pelvic floor rehab because I know
Sure.
that's a big piece of your practice.
Yeah, it is, and just from the outset, I want to just say this is for men and women.
Okay.
Men have a pelvic floor too,
Sure.
and they are dealing with a lot of issues as well. But I'd say the majority of my clients right now are women, and pelvic floor. I think starting with what the pelvic floor is it's a layer of three muscles or three. It's 3 layers of muscles. Let me say that way. And their 3 functions are sexual pleasure, supporting the organs of our abdomen, of our abdominal cavity, and keeping us continent, both bowel and bladder. So it has 3 super important functions. And the muscles of the pelvic floor are like any other muscle in our body. It's striated and it contracts and it relaxes. It's not specialized muscle like the heart is specialized muscle. It's cardiac muscle. It's smooth. This is like any other muscle in the body, which means that it's fair game for physical therapists to work on.
Nice.
But in that, also treating a lot of urinary incontinence, bladder pain, sexual dysfunction falls into that category. And also, as well, constipation and bowel issues. So, yeah, and that's where the pelvic floor therapy and the fascial mobilization stuff intersects.
Got it.
So working the fascia around the organs of the digestive system, the urinary tract system, and the reproductive organs.
Wow.
Yeah.
Yeah, it's good stuff. I've had pelvic floor therapy.
Have you?
Yeah, I haven't had pelvic floor dry needling though. That's
Yeah,
a whole nother level.
I know. It's exciting.
Yeah, it is exciting. Ooh, do I want to do that?
I know.
Yeah, it kind of
Yeah.
makes me like nervous and excited
I know.
all at the same time.
I know. It's
Yeah.
really cool.
Yeah, it's neat.
Yeah.
Yeah, and I have to say, I personally haven't had sexual abuse. I think maybe some sexual trauma, but that was probably on my own choosing. You know what I mean?
Right,
but
right.
no sexual abuse. And so I don't have that element. But how do you work with women who do? Because I know for me, getting on that table is a very vulnerable experience. It's like, okay, I have to bring a lot of courage today.
Right.
Yeah.
I think, in any session where I'm going to possibly do an internal pelvic exam, I give them full ownership of the session. We can stop any time. I walk them through what I'm going to be doing. educate them on the anatomy of the pelvic floor and what I'm trying to figure out is going on or not. I do ask them about their sexual history. And that doesn't necessarily, it's interesting and it's all in how you ask it, but sometimes I've asked people, have you had trauma or have you ever been abused? And they'll say no, but then the next thing they say is something that is actually trauma or abuse, but that's not the word they use for it.
Oh, interesting.
So it's really, the first session is a lot of talking and just getting that level of comfort. And I've had people say, absolutely not, you're not going to do an internal exam. The nice thing for me is there's so much I can work on externally. You can actually feel the pelvic floor muscles externally as well through the deep hip muscles. It's just a little bit harder to access.
Sure.
But if people say no, that's fine by me.
Yeah.
And I respect them.
Yeah,
their
that's
choice
great.
for that. Yeah.
Yeah, totally. I mean, everybody's where they're at and have a level of comfort and one day it may change, And
yeah, and it's a lot of times, as you know, when you work on people and you touch their body, it's very personal, right?
Yeah.
And and I think touching the pelvic floor is exceptionally personal, right?
Totally.
And so just getting, even when I'm working on someone for neck pain, they're tight and anxious and a little on edge that first session when I touch their neck. And the second session, it's a totally different experience.
Yeah, that's so true.
That
is so true. Yeah,
so I just allow that to happen.
Yeah, that's great.
Yeah.
Yeah, that's really great. Cool.
Mm-hmm.
Yeah. I love it. I love this stuff. And I would also encourage women, ladies, if you've never even heard of this stuff, because this was kind of new for me over the last couple of years, really. I mean,
right.
I didn't even know it existed. And the awakening that happened from that experience, and the flow that happens. I mean, my women know that, my listeners know that I look at things from an energetic perspective.
Mm-hmm.
And so if we have, like we were talking about earlier, if we have adhesions, there's an emotional component to that. There's an energetic component to that. And we're being blocked.
Right.
If that block, like I have an ankle injury right now, that block is in my ankle. Oh, when I get emotional, that gets worse. Of course it does.
Of course.
Right?
Right.
Yeah. So, when I look at ankle energy, I'm like, oh, okay, this is about me stepping forward. I'm making some huge changes right now in my life, and I'm so grateful to be doing that, and it's so exciting, and it's so freaking scary, and all of it, right?
Right.
So, of course, my ankle's like talking to me right now. So, when we look at pelvic floor and different things that we, bladder dysfunction, leaky bladder, leaky bowel, all the stuff, or constipation even, obviously,
right.
Intercourse pain and things like that, that's pretty given. But all of that stuff has an emotional component to it, and energetic blockages are what's keeping it being in a dysfunctional state.
I agree. And I think also, our society is lousy at talking to women about their own health, and especially around the pelvic floor. When people, after a woman has been pregnant and has a vaginal delivery, and there's been tearing of the muscles, the pelvic floor, the perineal body, and they're allowed to just heal on their own or with a couple stitches, and then told to, just give it time, and not given any resources to where they can go to get that scar tissue worked on. And also, talking, I think everyone's maybe had the experience of talking with a group of women and going, oh, I just can't do jumping jacks anymore. Since I've had kids, that's just, it is what it is. It is not what it is.
Thank you.
You should know that you should be totally continent. Forever. And you should not wake up 5 times a night to pee. I think if you're over the age of 35, you're allowed to get up once a night. But yeah, if you're finding that you're saying to yourself, like, oh, this is just because I'm fill in the blank. No, it should all function normally. And when it starts not functioning normally, go seek help to bring it back to a normal state.
Yeah. Amen.
Right?
Yeah.
And sex should be enjoyable, and there's not a point that it shouldn't be anymore, and all that stuff.
Amen.
So,
yeah, I know.
Right?
When I'm 80. Even when I'm 80.
Right?
Yes.
I know. You might need a little, extra lubrication,
Fine.
or whatever. But there's also an interesting thing with that, and I'll just go on this. I had a woman come in, and it was very sad, but she hadn't had any sexual intercourse with her husband for years, since their 14-year-old son was conceived. And her poor labia and the vaginal opening and all the tissue was so dry, and she couldn't even wear underpants because it hurt so badly. And it is truly, I'm just going to say, it is a use it or lose it kind of thing.
Yeah, it is.
Whether it's your self-stimulation or from a partner. We have glands down there that produce lubrication, and that tissue down there just wants to be lubricated.
And utilized.
And used. So
Yeah.
use it, ladies.
Yeah, amen.
Right.
Yes, I'm all about it. Go
Right.
out there and let us know how it goes.
Yeah. Little side note for everybody.
Yeah, and do your homework. So I know my PT gave me homework
Yes.
for the vaginal stuff
Yep.
and the pelvic floor stuff, and it was so helpful. And I noticed when I didn't do the homework,
Right.
things didn't get well as fast.
Well, and I think just saying, well, I do Kegels. There is a correct way to do a Kegel, and there is 1,000 ways to do it incorrectly. So I think I can do this with you real quick. This
cool.
is
Let's
really
do it.
okay. So someone taught me this the other day, and I was like, oh, that works. So if everyone visualizes, and you can pick your drink of choice, whether it's a smoothie or a milkshake, but something that's thick, and you're drinking it through a straw. And so if you guys all want to just practice, we'll do it first with the mouth, and you just suck in like you're sucking something that's really thick. So through pursed lips, and you're pulling in really hard with your air, right?
And you can feel the draw.
And as you do that, you want to have that same sense of puckering and drawing up towards your belly button of your pelvic floor. And the more constricted you make your lips, and the harder you pull in with your lips, the more you should feel your pelvic floor contract.
Yeah,
So
and I can
that's-
feel it in my abs too, yeah?
Yeah, in your abs, you should feel all your core muscles kick on. And you should feel as if your vaginal opening is puckering together and then lifting upwards towards your belly button. Yeah. I just think that's a really good visualization.
That's cool.
Yeah.
So that's the intensity it should be on a
Yeah.
Kegel?
And yes, and these muscles are, on all day. So yeah, we don't need them to be contracted at full strength all day long. They're kind of in the background, just keeping everything toned. But if you're contracting them harder than that, they're going to get tired and they're going to stop working. Yeah.
Awesome.
Yeah.
Awesome. Yeah, because when I was running,
Yes.
I would get really tight in that area, and I was like, what is wrong with me?
For sure.
You know?
Runners, athletes, you're putting a lot of stress. Anything high impact is putting a ton of stress on those muscles.
Yeah, and then of course I was doing my Kegels because I want to keep it all good, you know?
Yeah.
And I got a new boyfriend, I'm like, oh yeah, let's Kegel it up, right? And it's
Absolutely.
Like, oh boy, we gotta do something here.
Exactly. Yeah.
Yeah, cool. Thanks for sharing that. I
Yeah.
love to give the women a tool when
Yeah,
I'm doing these kinds
absolutely.
of things. So yeah, it's really awesome. So so if you were gonna instruct someone on how to take care of their pelvic floor, would this be this straw exercise?
Yeah,
that they
that's
would do?
one. I think that's part of it. So that's the contraction piece. And so following up with that, after you feel it contract, and we're sitting here, so it's all visualization. Like you should feel it drawing up and away from the seat that you're sitting on, right? But then can you let it relax? Can you let your belly relax? And can you let the pelvic floor relax and almost open or part a little bit or bulge down a little bit without exerting force, but can you really let it go? That's what most people have an issue with. So the things that I start people with is like, well, let's just stretch the inner thighs out. Let's just stretch the deep hip muscles out. Like we all know the figure 4 stretch. We all know the butterfly stretch. We all know happy baby, things like that. That starts tuning people into how to relax the pelvic floor muscles. They should not be contracted all the time.
Okay, well that's really good because I know I do a lot of like stretching and stuff before I work out, but I don't necessarily think what's happening in my pelvic floor right now.
Yeah.
You know?
And the breath has a lot to do with how the pelvic floor is working. So the core muscles are a canister, and the diaphragm, which is our major breathing muscle, is the roof, and the pelvic floor is the floor. And then the walls are the ab muscles and the deep back muscles, the multifidus. So all of them need to work to have good functioning of the pelvic floor and the core.
Nice.
Yeah.
Nice.
So breathing, making the belly big, really letting go. We hold a lot of stress, I think, probably in the pelvic floor, and we don't even realize it.
Yeah, for sure not.
Right.
Yeah. Cool.
Yeah.
Very cool.
Yeah.
Love it. Yeah, this is what we do to turn ourselves on. Like, I see so many people, women especially, who, I don't even really think about this with men, but when I see a woman, I can commonly see where they're holding their energy, where they're coming from in their activities in the day. And some people are really like, especially like Brazilian ladies and things like that, they're in their hips, they're in their vagina, they're in their feet. They're like, shake it and they're good, you know? But for the most part, women are all up here in their throat.
Right.
They have these high-pitched voices,
Right.
or they're kind of heart-based, but they have total disconnect with their lower body.
Right.
And
Right.
then, navigating the world from that place is not so healthy because we tend to want to give and give and give, and we can let ourselves get walked on, or we overgive, and we're not really feeding and nourishing ourselves, nourishing our feminine, nourishing like being in our pelvis, which is where our power is.
Right. And I think, and that's something that I struggle with. I think being a healthcare provider, being someone who picks up on other people's problems and helping them with their issues, and forgetting about self-care. And I've that's been my big focus over the last few weeks is, well, wait, what about me? I read something somewhere, and it said list the top 5 most important things in your life. And so I did that, and then they said, and then how many of you listed yourself as first?
Woo, I just got chills.
Right? And I'm like, oh, I don't think I even put myself in the top 5. And that was really, like, it was really upsetting. I was like, oh my gosh.
Sure.
Wow. My husband, my kids, my business, my family, my home, all that. And I'm like, oh, myself, I don't love myself, and so that's when I was like, this is, again, the community that I've joined, and I'm like, right, let's turn this back on myself because I think it'll help everything else.
Absolutely. And plus, when you're tuned into yourself and you're working on other people, it comes to them on a subconscious level.
Right.
Oh, this is the pattern of health and well-being.
Right.
And you're offering that every single time you work on something, regardless if you have that conversation or not.
Absolutely.
Yeah. I mean, I get it too. I have to make sure I'm doing self-care. I have this, I think I may have told you, I go to this sensual dance class, and it is how I get back in my body.
Oh, yeah.
Yeah, it's like, and it's not always easy, and it's pretty vulnerable, and I'm like, oh man, I got to tune into myself. Oh wow, really? And sometimes I feel so disconnected, and I just sit in class and cry because I'm like, oh my god, I'm so disconnected, But then by the time class is over, I'm like, woohoo!
Right?
Life is so good.
Right?
Yeah, and then
that's
I
great.
really believe that, especially us as women, I don't know about men, I'm not a man, but when we're tuned into ourselves on every level, in our yoni and in everything,
Right.
then that's how we access God consciousness. We can't access it being out of our body
Right.
at all. It
Right.
seems like we can, in
Right.
meditation, I go into the ethers and I get a lot of information, yes, but what about bringing it forth into this physical world, into the offerings that we're here to give?
Yeah.
That's where the juice is at.
I agree. Yeah, that's
Yeah.
really powerful.
Yeah, so good. And you're facilitating that for women, so
Yeah.
thank you.
Yeah. My pleasure. Yeah.
There's a couple of other things I know that you're up to, the diastasis recti. Speak to that a little bit.
Yeah. So, and I think, for us Colorado ladies who like to be uber fit and stay super active and fit through pregnancy. So let me actually back up for a second. The diastasis recti is the splitting of the abdominal muscles at that vertical line that runs through your belly button. So it usually happens when you're pregnant, but it can happen. I've seen some men who just have that kind of, classic beer belly, and they can split their abdominal wall as well, right? But it happens a lot with these super fit, like marathon running women in Colorado who are really lean, and then they start growing this baby in them, and their uterus starts expanding, and there's no stretch, there's no room to groove, and so it splits. So the problem with that, obviously, is now your core stability is disrupted. So then you have the baby, and there's still the split there, and you can't get a good engagement of the transverse abdominis muscles, which help as our muscle girdle to support our spine and our bodies. So they deal with back pain. Sometimes when it's bad enough, you can start herniating your intestine.
I was wondering. It seems like things would just fall out.
Eventually.
Wow.
Yeah. And it's not covered by insurance unless the intestines are herniating outward. If it's split,
gosh.
I know. It's cosmetic surgery.
Oh, Jesus.
If it's not a true herniation. So the definition of diastasis recti, and it can be diastasis recti or diastasis, I switch back and forth. It has to be more than 2 finger width of separation. Okay. So I have 13-year-old twins, and so I had one, and mine is about a finger's width now, and it's not technically a diastasis recti because it's only 1 finger.
Oh, wow.
Yeah,
so you've healed that up.
Yep.
Using...
Yep, and so the technique is a fascial release technique, and I start at the spine, and I work from the spine around the abdomen to the belly button with these like a fascial mobilization. And I have seen the biggest diastasis recti I saw was 8 fingers wide of my hand,
gosh.
and I don't have small hands.
Can you see that on the belly?
What it looks like is wrinkly, poochy skin, like it has no elasticity to it. Yeah, have you seen that?
Yeah,
like the,
for sure.
And I like you just see it, and then if they lift their head, you can feel the split and the walls. You'll feel the rectus abdominis, our big muscles that run up and down, the 6-pack muscles. You'll feel the walls of them split apart.
Oh, wow.
So then with that woman who had the 8 finger, I gave her some home exercises and some self massage, like techniques, self approximation of the muscles, and then the treatments I was doing with her totally got rid of it.
Oh, that's so cool.
Yeah, it took a handful of sessions.
And so could you see the skin change on her belly?
So that took a little bit longer, and that comes with then re-engaging the muscles now that they can. The skin change takes a little longer.
Sure.
Yeah. But then I have them do, with coconut oil or something and some essential oils, to help tone the skin, bring elasticity back to it.
Nice.
Yeah.
Right on.
Yeah.
Cool.
That's really great. And, it makes people feel better about their bodies,
Sure.
but then it also reduces back pain and other issues.
Yeah.
Yeah.
I had a patient in South Dakota, and she had that, and she got therapy for it, and it changed everything for her. It really made a huge difference in her mental mindset.
Yeah, absolutely. Yeah, it's like that mommy belly. And again, some people say, "Oh, I just have a mommy belly now, and it's just how it is." I'm like,
Right.
no, like
it doesn't
that.
have to be that way.
No, I think as we become older, like postmenopausal, and we're not making as much estrogen, you may see some fat depositing on your abdomen. That's just what we do, and that is what it is.
Sure.
But when you're 30 something and you have a mommy pooch, yeah, no.
No. No. Awesome. Cool. And then you're also a certified Pilates instructor?
Yes. I've been certified for 15 years. I used to teach a lot more. I utilize the exercises in my PT practice. I teach a couple private clients, more because of the relationship I have with them, but it's more about using the techniques of Joseph Pilates to help people re-engage their core muscles. So it's a really powerful, and easy on the body form of exercise.
Yeah, I love that you integrate the two. I've gone to Pilates. I had a chronic hip injury, and the report on the MRI says there may be a micro tear in my labrum. It's not even conclusive,
right?
And so I'm like, well, okay, maybe Pilates can help, and oh my gosh, so good.
Yeah.
And this wasn't just a mat class with a bunch of people. This was on a reformer with a teacher, just her and me, individual training, and she had the ability to see these little tiny micro things that I had no idea that I was doing in how my body moves, and retraining that. So just knowing that, and knowing that you're integrating that into the PT, especially with the diastasis recti, and
and
probably any joint,
matter. Muscle recruitment, and it's nice because it's elongating muscles as well as showing them how to contract. It uses a really good breathing model, so that you're not ever holding your breath or trying to bear down. So it's just a really great way to make make those muscles work really well.
Yeah, that's so cool.
Yeah.
Awesome. Is there anything else you would like our listeners to know?
Gosh, there's so much, but
I know you're so full.
I could just go on and on.
Just keep talking to you.
I know, but no, I'm just I've been practicing. My newest clinic is holistic physical therapy, and it's my own venture, and I work in a great clinic with other practitioners. It's a co-op of healthcare providers who all have the same philosophy on treatment, which is great, but very complementary to each other. And it's been so amazing as a business person to go from being a staff PT for a really wonderful person where I started my career, to evolving into a clinic that I owned with two other women that was wildly successful, and then stepping away from that to really, again, nurture what I needed and where I needed to grow, and not being, being frightened about that jump, but really being able to grasp it and move forward with it. And I've been there since September 2017, and it's just amazing.
That's so wonderful.
Yeah.
What was your greatest struggle in that whole
evolution? This one?
Yeah.
Well, it's changed. I think the breakup with my partners from my last clinic was hard. It felt like a divorce. I've never been divorced, but I think that's what it probably would feel like. It was very emotional, and that was hard. And I think my newest challenge is protecting myself, is setting proper boundaries, being your own business owner and providing services to people. You don't want to tell anyone no, but it's okay to say no to people, so that I can now have Fridays off to come and talk to you and to get my own acupuncture, and to get my own chiropractic care, and to get my own energy work done for me, and being okay if I say no and then they go someplace else. That's their choice, but there's so many other people who were patient with me and wanting to see me specifically that I'm, currently booked 3 weeks out. And so I feel really happy to be that busy in a space that I'm doing so much better at taking care of myself. And it is a struggle. I have to really practice saying no. No is a full sentence, right?
Yes, it is.
And that's so hard. I think healthcare providers are hard. It's hard to say no.
I know, it is.
So that's my current struggle, ongoing, probably forever. And I'll hopefully get better and better at it.
For sure, obviously.
Right. Yeah.
Well, you clearly have great assets and tools, and I did a little research and found out you were in the top 20 PTs in Denver.
which I should know, and I didn't know that.
I think that's hilarious.
That's really exciting. I'm going to look it up. I'm going to look myself up. Yeah.
You should. Yeah, do a little Google search. If you haven't done that, ladies, do a little Google search on yourself and see what comes up. And you might get surprised, So where is your office located, and how can our ladies get in touch with you?
Sure. So I'm in Wheat Ridge, Colorado, which is just west of Denver. It's really not that far out into the burbs, but I think my location is great. So if you live in Lakewood, Golden, Arvada, Denver, Boulder, yeah. It's a pretty easy access point. It's on the west side of the city, so it's easy to access. My website is holisticpt.net, and you can also email me at Jenn Lane. That's Jen with 2 N's, Jenn Lane at holisticpt.net. I do take all insurances. I think that's been important for me to be accessible to people who need it. So I do take Medicare and Medicaid as well as most private insurances.
Wow.
Yeah, I like to provide it to people who need it,
Sure.
who can't otherwise afford it.
Right.
So go to my website. There's a contact form there that you can always fill out, and then I can contact you.
Awesome.
Yeah.
Thank you so much for being here.
Thank you for having me.
Yeah,
this has been great.
Yeah, absolutely. And I know the ladies got a lot out of it, and I'm excited just to continue to learn more about you as our relationship grows.
Yeah, I'm excited.
Yeah, awesome. All right, ladies, thank you so much for being here,
And do whatever it takes to turn your soul on. Thank you for tuning in to another awesome episode of Turn Your Soul On Radio. If you're enjoying the show and it's making a difference in your life, I'd be super grateful if you'd head on over to iTunes and leave a heartfelt review, which tremendously helps the growth of the show. Feel free to leave any suggestions or questions in your review, or you can shoot us an email at admin@drbrandyvictory.com. I also would like to invite you to become a deeper part of the Turn Your Soul On Radio community, which you can do by joining our private Facebook group, Turn Your Soul On. I'll leave a link in the show notes for you. Thank you so much for being here today, and I'll talk to you next time. Have a fantastic day.
This podcast is for information purposes only. Dr. Brandy Victory is not a medical doctor, and the views and statements expressed on this podcast are not medical advice. This podcast, including Dr. Brandy Victory and the producers, disclaim responsibility from any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.